Well, Nationwide Children's Hospital is about a month away from opening a first-of-its-kind facility. It's called the Big Lots Behavioral Health Pavilion, and its sole focus is children with behavioral and mental health issues. So all month long, NBC4 is partnering and working with Nationwide Children's Hospital to highlight why the need for this type of facility is so big and so great, and we want to help break the stigma of mental illness by working with these experts. And we do that by talking about it with each other and our children. So here with us today is Dr. Mary Frey-Stad from Psychiatry and Behavioral Health at Nationwide Children's Hospital, with ways that we can talk to our children about how they're feeling, what's going on in their lives, and to just try to take some of the edge off of it. Thank you so much for joining us. We were just having a conversation, and I said commit suicide, and you said that's the wrong term to use right now. So that starts it right there. Let's start the conversation.
Absolutely. So we never talk about people committing cancer or committing heart disease. So why would we talk about committing suicide? People die from suicide. It is almost always the result of a treatable disorder. And so we need more intervention, we need it available.
And parents need more information. So how do we start to have that conversation, doctor? And at what age should you start talking to your children about how they're feeling? Mental issues, mental things they're dealing with.
I think there's never a time that's too young to talk about how you're feeling, because what parents can really model for children and teach their children is that kids have a whole range of emotions. In fact, you can have two emotions at the same time, as confusing as that might be. But parents can say, you know, I'm so excited that Grandma and Grandpa are coming to visit today, but I'm a little nervous because we're not quite ready yet. So can you help me get things ready?
But then sometimes we're putting off anxiety. We're making our kids feel what we're going through, and that's not fair sometimes.
Right. So parents don't want to be sharing, you know, I'm not sure that we can pay the bills this month.
Okay, tips.
Those are the kinds of things perhaps they could keep to the adults, but to use emotion words, I'm feeling this way. I noticed that you've just been really quiet this evening. I'm wondering how you're feeling.
Okay.
You know, asking some questions.
We've got some information so that parents can ask some of those questions. We're going to share this with people at home, and they start with, just like you said, starting some of the conversations. Start talking about what's going on in their world.
Absolutely.
What's in school?
Sure.
Playground.
And absolutely. And we know that, I mean, there are lots of news stories that are coming out about the high rates of anxiety and depression, particularly in teenagers. And so you could ask your daughter or your son, you know, what do you think about that? You know, have you noticed that among your friends, among other kids at school? Just start a conversation. And before you put in your own 2 cents, give your child a chance to say what's on their mind, and try really hard not to tell them what they just said is right or wrong, but let them really express their own perceptions, and to know that their experiences are likely different than what you remember at that age.
And I also love how you say, when you ask your child, how you doing, what's going on at school, what's going on in your world, be ready for those answers.
Yes, and it's a great time to talk. I find when kids are not looking eyeball to eyeball with their parent. So when you're driving in the car, it's a great time for a conversation. When you're tucking a child into bed at night and you're just sitting on the edge of the bed, those are great times to have conversations.
Phones down. Dr. Mary Frey-Stad, thank you so much for joining us, and we look forward to, of course, hearing from you every week here, every Friday here on NBC4. And if you at home have an emergency, pick up the phone and call 911 for non-life-threatening situations. Call your local psychiatric crisis line. We've posted those numbers on our website, NBC4i.com. And if you want to check out the new Big Lots Behavioral Health Pavilion, Dr. Frey-Stad is very excited about her new office over there because it's calming. There is an open house. It's Sunday, March 1st from 11 to 3 at the Nationwide Children's downtown main campus, and that is on Butterfly Gardens Drive. Also, be sure to check out our live stream at 5:30. Our very own Christine Varconi will be talking to Dr. Frey-Stad about balancing your child's mental health and well-being, and of course, education. You can watch it through our website, NBC4i.com, our Facebook page, or the NBC4 app. For now, though, we'll be right back.